And much like Elizabeth, I had terrific success. I've lost 60 pounds. And more importantly, my cholesterol also went down by 60 pounds.
GLP-1s Beyond Weight Loss. 3 claims from one of the most respected voices in longevity.
Unlike 5 years ago when we started using semaglutide in patients and were just watching muscle fall off these people, and frankly, my point of view 5 years ago was, I don't know about these drugs. I think there's some benefit in some people, but I think there's a lot of downside. I today think that virtually anybody can use these drugs safely, but, and by safely, I don't just mean in the obvious sense of the word. I mean safely for long-term muscle health as well. Within 3 months of being on 2.5 milligrams of Tirzepatide, this individual's OGTT had almost normalized, and I suspect by about 6 months it will.
That's fascinating.
And we've managed to do this without any weight loss. So this to me is the interesting question, right? Which is when you look at some of the Alzheimer's biomarkers, which are improving significantly, it begs the question, should this be part of the playbook for an individual who's at high risk? Now, it seemed very counterintuitive to give Tirzepatide to people who have a BMI of 23. But we've been able to do it without them losing weight. So again, very careful strategies around nutrition, and the effect on their diabetes is profound.
So they're looking more metabolically healthy.
Oh my God, totally. I mean, these are really interesting cases that maybe at some point, obviously in a de-identified way, it would be interesting to talk about, where you have OGTTs that are unrecognizable. Like, you simply cannot believe the degree of metabolic dysfunction in a person who otherwise looks the way they look.
More importantly to me, I am built with the genetics of obesity, diabetes, heart disease, high blood pressure. They're all loaded in my genetics.
Yes.
And so I've been fighting that my whole life. So what I'm most curious to ask you is, do you think that these medications can prevent obesity?
We know right now the benefit of treating patients with obesity to prevent all of these obesity-related diseases is clear. There are many studies coming out about heart disease, about preventing diabetes, about treating knee osteoarthritis, about obstructive sleep apnea. All these things are coming out.
Compare clinics. Find legitimate prescribers. Take the quiz at glp1clinics.org/quiz.